Kengo Kusano and Mike Gibson joining you live from AHA 2024, and we're talking about cryoablation versus radiofrequency ablation. Talk to us about what you found, Kengo.
Thank you very much. Catheter ablation is recommended as a class 1 intervention for patients with drug-refractory persistent atrial fibrillation to relieve symptoms, recurrence, and progression of atrial fibrillation by international guideline. And so now, a lot of energy source employed for atrial fibrillation, AF ablation, including radiofrequency, cryoballoon, laser balloon, hot balloon, and pulse field ablations recently. So among them, radiofrequency, RF, and cryoballoon ablation, CB, being widely used worldwide. However, there are still lack of data. So between the RF and cryoballoon ablation in patients with persistent AF. So that's why we conducted this study, a prospective, multicenter, randomized, non-inferiority clinical trial. And so this study randomized 500 patients with persistent AF, one-to-one fashion, so cryoballoon ablation or radiofrequency ablation across 12 sites in Japan. And so they are all high volume centers between 2021 and 2023. And we allowed the adjunctive ablation lesion sets targeting sites outside the pulmonary veins were performed at the physician's direction. During the follow-up, so one channel electrogram were recorded twice daily for 1 year after catheter ablation using a portable electrogram recorder, in addition to other scheduled examinations, including 12-lead ECG and 24-hour Holter recording at 3 and 12 months. The primary endpoint is atrial tachyarrhythmias lasting more than 30 seconds, occurring outside the 90-day blanking period were considered the recurrence. And the result showed the cryoballoon ablation demonstrated non-inferiority to radiofrequency RF ablation for the occurrence of atrial tachyarrhythmias in patients with persistent AF. CB ablation demonstrated shorter procedure time, so less fluoroscopic time. So that's why, until now, there hasn't been a prospective randomized study conducted with sufficient sample size comparing the occurrence of catheter ablation between cryoballoon ablation and radiofrequency ablation in patients with persistent AF ablation. So that's why, I think, our study shows that catheter ablation with persistent AF fibrillation, cryoballoon ablation, which is a shorter treatment compared to the radiofrequency ablation, is something you may want to select for patients more often. Thank you very much.
Thank you for joining us, Kengo. Thank you for your presentation, and thank you all for joining us here live from AHA 2024.
Yeah, thank you very much.